Hello, my name is Poran. I'm a clinical counselor and doing my doctorate degree in counseling psychotherapy. I have been supervising many mental health practitioners, counselors, social workers, and other people in helping profession over the years. And in this series of talk, I want to kind of explore some ideas of how we are working as counselors, as mental health practitioners, how much awareness we need to have about ourselves, what's going on for us, and what's going on for our clients. I want to also talk about trauma. And the concept of trauma, of course, is being talked about by many scientists who have big names in the field. And there are tons of research about how adverse childhood experiences causing adult pain and suffering, adulthood pain and suffering, and also leading to more traumas at times due to choices people make and kind of use of substances and etc. However, that concept of trauma at times is not being understood according to the culture of the clients. I mean, we have a big concept of trauma, but we need to kind of break it down to the experiences, the lived experiences of the client who we are seeing in our therapy room. I mean, experiences of trauma is different for each person, as we know, right? So how we are coping with traumas, if it's the generational traumas, if it's the colonial traumas, if it's the sexual abuse and sexual violence traumas and childhood traumas, and depending on the environment of the environment and the social economic background of the client, people handle trauma differently. And it's important to kind of acknowledge those individual coping mechanism. At times, people with traumas, I mean, trauma that many of people in my community, we are still not able to talk about the traumas because we fear. I mean, and this is, we fear judgment, we fear being belittled by others and being seen as weak. I mean, and this is the same for indigenous communities, despite of the residential school traumas and the huge mental health challenges that these people have suffered. Still, a lot of those elders, they fear talking about what happened to them. So we need to understand that. We need to kind of recognize it and not pushing for the details. At times, I have met clients, of course, clients, they window shop, right? They come to different counselors until they find the right match, and they talk about the previous therapies they have received. So I hear a lot of stories about how other therapists, they have pushed for the details of what happened, however, not managing to kind of heal, not only healing, I mean, um, conceptualize that pain and suffering that it is due to opening up the can of worms, right? The trauma, the details and so on is not helping in the moment. At times, what is helping is to people be able to explore little by little, gradually, what's happened to them, and manage emotions according to those stories in the moment. So just talking about what happened doesn't help. So that's how I believe we mental health practitioners, we need a lot of conceptualizing clients and tailoring our intervention to clients' needs based on their kind of ability to adjust and to be able to explore little by little. People need to build trust first, right? And so these are at times very alarming, and when you hear these stories. So hopefully we become more aware and become mindful of how people deal with traumas and manage through those emotions differently. So I hope this video helps, and the series of education that I'm offering for free helps, and I appreciate if you share it with the group of people, co-workers you meet, and also subscribe to my channel. Bye.